What do our cardiology colleagues say about TAVR against surgical valves? He said it's too invasive. You don't want to go on a heart and lung machine. Surgery's too invasive. Remember, he's talking about sternotomies, not minimally invasive surgery. Adverse events like stroke. You do like to talk about the valve having no patient prosthetic mismatch. The hemodynamics of a TAVR valve are supposedly unbelievable. I'm not positive that's true. Yet I will give you that your patients get out of the hospital quicker than the surgical patients. So my question, Klaus, if surgery is so invasive and so bad, why is there no mortality benefit? You yourself said, well, all we can show is that, hey, TAVR's just as good as surgery. You're not better. So I don't understand why everybody's so afraid of surgery. You haven't improved mortality whatsoever. We don't have perivalvular leaks. No surgeon would let a patient leave the operating room with a perivalvular leak. Our costs are lower and our durability is clearly better. Number two, there are some catastrophic events with TAVR. Some of the other physicians talked about it. Device embolization, coronary obstruction, annular rupture, and valve thrombosis. They're rare. I'll give you that. They're rare. But you do have a lot of common complications you don't like to discuss, like the vascular injuries. Those are significant. Conduction defects, very high pacemaker rates. Your stroke rate's higher. And you have no idea what the durability is. In fact, most people are thinking the durability is pretty bad right now for TAVRs in terms of putting them in younger patients. So again, I would agree with you, Klaus, maybe not TAVR yet for younger patients. We're not sure. Here's some data published in the Journal of Cardiology in 2017, a transcatheter versus surgical valve replacement propensity match comparison. No advantage for TAVR with mortality, both pretty high in that group. Obviously, that's the higher or intermediate risk patients. Stroke risk was higher in TAVR than in surgery, probably not significant. Days alive out of the hospital were the same. Yes, the TAVR patients do go home 2 days earlier.